I've had a couple of patients come in with a panic attack. It could be the season, this being winter in Chicago, where you don't see as much sun as the summer. Maybe a little seasonal affective disorder, maybe a little bit of post-holiday depression or anxiety, but we'll keep the topic easy, panic. When I see anybody for panic, I guess the easiest way to fight the disease is to know what you're up against. I think, in my own words, I usually will label panic as the extreme presentation of anxiety. Almost like a heart attack. You can have heart disease, but heart attack is the concentrated, worst expression of heart disease, all at one time. Hopefully you'll make it through that, you live, you get to the emergency room or the cath lab, and we save you. Panic attack is the worst concentrated expression of anxiety. Most of the time, it doesn't lead you to the hospital. Well, I should say, it doesn't get you an admission to the hospital. It might get you to an immediate care center or an emergency room. But when the big diseases are ruled out, then the soft disease is ruled in. I hate to say soft disease, but usually anxiety and panic attack is non-life-threatening. Now, let's just break it down. What usually happens with the brain is that it is the master organ in control of several other systems. The nervous system, specifically the central nervous system, can control the heart or the circulatory system, the pulmonary system or lungs, the reproductive system, the digestive system, everything pretty much. So if the nervous system goes off or is not functioning properly, you'll have a whole smattering of symptoms from each of the other systems. You'll have chest pain, you'll have upset stomach, you'll have diarrhea, you'll have shortness of breath, you'll have difficulty with having your, or an irregular period, difficulty with reproduction, difficulty with sleep. You'll have a whole bunch of symptoms all in this potpourri of problems, and that usually points us into the right direction. I mean, I'm talking about clinicians. When we have all these symptoms that seem to pop up suddenly, yet we rule out big disease, like with a CT scan of the brain or an EKG. Usually we'll say, okay, it's not life-threatening, so take a couple pills, go see your doctor for further workup. I think the medical system now is that of rescue medicine. We will be really good at trauma, heart disease, strokes, cancers, but not so good with everything else. So we usually wait for the diseases to manifest at their worst. And again, panic attack can be considered a concentrated expression of anxiety, in my opinion. So to best understand what happens, I did a little diagram. If an event occurs in our lives, everybody's interpretation of the event is different. Some people will see an event like somebody getting hit on the street as something very sad. Some people will see it as maybe that person saved the other 3 people from getting hit. So you'll have good interpretation and bad interpretation. But when an event occurs, our brain interprets it. The reptilian brain, or the midbrain, the basic primitive brain, has ways of interpreting events in the environment in their most basic forms. So like a dog, a cat, a lizard, if it essentially boils down to love and happiness or pain. So if there's pain, move away, do actions to get away and stay away. If it's love, go forth. If it's food, go forth. So the great thing with events and mammalian brains or the human brain is that we have this thing called a frontal part of the brain that interprets and gives us abstract thinking. With abstract thinking, we've learned to evolve into this great species, but I think for some very few people, it actually works to their disadvantage. So what will happen with a panic attack or an anxiety patient that breaks out into a panic attack, it will be the event is interpreted, and the abstract thinking makes the brain interpret the event in a bad way. It starts to make us worried about this event leading to other events, and that sends more information to the brain. You start to abstract think in the wrong way or pathologic way, and then you have more ideas about this event. It spurs on more interpretations, more abstract thinking in the wrong way, and then you see a cyclical increase in bad thoughts, ideas that are out of proportion to what's going on truly in the environment. I think everybody's allowed to have a little anxiety and a little depression. That's why I put the extremes here. A lot of us will experience depression, reactive depression with loss of a loved one, a parent. Anxiety with getting up in front of a public arena and speaking. So you'll have little waxing and waning out of the ordinary, but when you have manifestation where it seems a little bit out of proportion to the event that occurs, then we say it's a pathology. If it interferes with, say, daily living, it's a pathology. It interferes with eating, with working, with getting to work, with going to school, with interacting with other humans, it's a pathology. And again, panic attack, to take it in its most basic form, will usually be a very non-threatening event experienced by one person and interpreted in the wrong way. So it escalates into this unusual presentation of shortness of breath, chest pain, abdominal discomfort, diarrhea, flight of ideas, difficulty with speech, and everything else that relates to what I mentioned in the beginning. Abnormal responses from each of the systems in the body. What I like to do with patients is have them realize that they're not going to have, well, you always have to make sure that there truly isn't a problem. And usually what we'll do is we'll look into the brain, look into the heart. Those are the two biggest systems. Sometimes a couple blood tests. But once we find we don't have any life-threatening disorder that's going to disable us immediately, then we start working with the behavioral health teams. I think there's still a stigma with giving somebody a label of anxiety or depression and telling somebody that you have to go see a counselor. I even soften the word counselor instead of saying psychiatrist or psychologist. I've gone to the extreme of when people say, I don't want to see a psychiatrist, I say, well, how about a neuropsychiatrist? And that softens the term psychiatrist into thinking there's some science into it. And there's actually neuropsychiatrists that I use that I think are outstanding. But again, it's because people have this perception that when they have a disease that's behavioral health related, as far as the diagnosis, it makes them very vulnerable and weak. And almost it puts people to shame. So I think there's still a stigma of being labeled that way. And because of that stigma, nobody wants to go to the true treatment of choice, which is always psychotherapy, cognitive behavioral therapy. Our behavioral therapists and our behavioral centers are fantastic now with helping get people back to life, back to performing in the work environment, back to family and interacting. And it takes a lot of visits, just like physical therapy, just like heart disease. You don't just get off of the catheter or the bypass table and get back to your daily life. You have to gradually be introduced back into functioning with a normal heart again. Same thing with the disease process. You have to learn about the disease, stop its accelerated presentation, and reverse it so it doesn't have such a bad outcome in the long term. It usually means you have to get back down to the basics of why this brain or this human is interpreting events the wrong way. And that takes a lot of bonding, takes a lot of Q&A, takes a lot of therapy. Couch time, like we used to call it in the 70s. But I guarantee you that when you see a therapist now or a psychiatrist now, it's not just couch time. It's very detailed questions on past history, relationships, how things developed, why we got to this point. The problem now is that with the social problems that are occurring in our daily communities or our average communities, things are postponed and so complicated by the time we see them in the clinic that it's very difficult to, number one, diagnose, number two, to get therapy for, and number three, have the patient stay in therapy until the disease process is controlled. That's why it's sometimes more concrete to say, listen, you have this kind of disease process, anxiety with a little panic attack. People feel that when they have a diagnosis and there's a pill for that diagnosis, they feel more comforted. Unfortunately, the pills are really just temporary. Just like cholesterol-lowering medicine is temporary to prevent the heart attack. Just like high blood pressure medicine is temporary to prevent the stroke. All those measures, medicines I mean, if you don't change your lifestyle, no matter what the disease process, heart disease, stroke, diabetes, or anxiety, you will blossom and need more medicines in the future. I guarantee you the majority of people that just rely on pills will usually be in to see me because things have failed in the next event or the next decade or the next milestone of life. So the problem with panic is that we have to first diagnose it. Once you get diagnosed with panic, I think if it's extreme, medicines are necessary to get you back to functioning at least, get you not scared to go outside in a public venue, to go swimming, to leave the house, not thinking that there's some issue with the gas still being on. That's more obsessive compulsive, but still, it's all related. Once the medicines get the patient to function back in community, then we have that patient get into therapy. So the biggest medicines you hear about are Xanax or the benzodiazepines. They work to calm things down quickly. If anybody's ever taken Xanax, I would equate it to having a shot of alcohol and smoothing things out. So if you're in an escalating panic attack and you're having all these symptoms come up, sometimes popping in that Xanax, depending on what the doctor gives you for a dose, you'll start to have the symptoms stop and then reverse themselves. And then you rely on those activities or those techniques or those exercises that were taught to you or developed for you by the therapist, the psychiatrist, the counselor. That's why it's so important. If you just rely on the pill, you'll be popping in pills because there'll be more and more events that occur that will turn on the anxiety or panic attack. If you have a medicine and it just works after the event, well, fine, or after the abstract thinking, fine, but the idea is to change the abstract thinking. Once I have somebody controlled with the big medicines, I sometimes will advise them to get away from those stressors, temporarily or permanently. If the stressor is work, which it usually is, or at least it's an instigator, I would give them time off. Family Medical Leave Act is sometimes taken advantage of. Or just a few days to get into an inpatient or outpatient behavioral health program. The intense workup, they usually give some insight to a patient about this is a disease process and it can be broken down and fixed. But again, the idea is not to just rely on the medicines, the big prescription medicines. The idea is to get the medicines to get things controlled and get into counseling. I also rely on other things. If it's not that extreme and there's just one attack of panic every couple of months, sometimes I will use a herbal concoction of either a combination of magnesium, 5-HTP, St. John's wort, SAMe, even kava kava. There are things that you can use to kind of help the brain not go into that accelerated circle of events. And skullcap, valerian with hops, all these are my favorite. And again, they have to be studied. They have to be used in randomized controlled trials to prove that they do help first. And most importantly, you got to make sure it's not going to interact with your prescription medicines. Not only the benzodiazepines or the SSRIs or the other medicines that help with behavioral health, it can also, those herbs can also interact with the high blood pressure medicine, cholesterol medicine, liver medicine. So you have to be very careful. You have to go to see a doctor for those kind of, you have to at least see somebody to clear you first before you just start taking all these herbs. Once you have things under control, whether it's prescriptions or herbal medicine, then the counseling really has to take over. And not every counselor and every patient will match up properly. Sometimes you have to find the right counselor and go to several different people. Attempt at least to interview your counselors, your behavioral health people. You also have to have somebody that will talk to your primary care doctor to give feedback. Maybe we get you off medicines, maybe we wean you down, maybe we increase the medicines. So you can see it's a community of help in the medical field that gets people back to functioning again. But most importantly, the idea would be if there is a disease process, there usually, if you go to the right doctor, if the doctor can find it and listens to you and picks out exactly what's going on and then rules out big disease, there is always a way to reverse it. Instead of cycling it up, you can cycle it down.